Hello, today we will begin Mood Disorders, Chapter 23, Part 1. This is Part 1 of a two-part YouTube lecture presentation. However, your student PowerPoint is one file. Mood disorders are prolonged and disturbed emotional states that affect almost all of a person's thoughts, feelings, and behaviors. It impairs their daily living and their everyday functioning. The first mood disorder we will look at is major depression. Major depression disorder is marked by at least 2 weeks of continually being in a bad mood, having no interest in anything, and getting no pleasure from activities. A person can have 4 of the following symptoms: problems with eating, sleeping, thinking, concentrating, making decisions, lacking energy, thinking about suicide, or feelings of worthlessness or guilt. The next mood disorder we will talk about is bipolar I disorder. It is marked by fluctuations between episodes of depression and mania. Manic episodes go on for at least a week, and during which a person is usually euphoric, cheerful, and high. High meaning they can literally become high on their own brain chemistry. It also has 3 of the following symptoms: a great self-esteem. They have little need for sleep. A person with bipolar can speak rapidly and frequently. They have racing thoughts. They're easily distracted, and they pursue pleasurable activities. Dysthymic disorder is another mood disorder that is characterized by being chronically, but not continually, depressed for a period of 2 years. Persons experiencing at least 2 of the following symptoms will be poor appetite, insomnia, fatigue, low self-esteem, poor concentration, and feelings of hopelessness. SAD, or seasonal affective disorder, is when people become depressed when the number of sunny days decrease, usually during fall and winter, and they recover with the arrival of spring and summer. Occurrences in the population for depression is that 6 million Americans diagnosed with depression every year. 16% of the adult population report at least one episode of major depression. Depression occurs in women more than men by a ratio of 2 to 1. 1.3% of the population suffer from bipolar I disorder. 1.6% suffer from only manic episodes. 6% of the population suffer from dysthymic disorder. Next, let's take a look at the causes of mood disorder. Biological factors underlying depression can sometimes be genetic, neurological, chemical, and physiological. They may predispose or put someone at risk for developing a mood disorder. If one identical twin has a bipolar disorder, the risk that the other twin will develop the disorder may be as high as 80%. Psychosocial factors also contribute to the cause of mood disorders. Personality traits, cognitive styles, social supports, and the ability to deal with stressors that interact with predisposing biological factors to put one at risk for developing mood disorders. Predisposition of these biological factors does not necessarily mean that they will cause a mood disorder, but what they do is set up someone for being at risk, at a higher risk than someone who does not have these predispositions. Major depression and dystemic disorder are treated with antidepressant drugs that act by increasing the levels of specific groups of neurotransmitters that are involved in the regulation of emotions and moods. A second form of treatment is psychotherapy. Usually, psychotherapy and antidepressant drugs combined bring the best treatment results. In the treatment of bipolar I disorder, the past drug of choice has been lithium, which is a mood stabilizer. Also included with lithium now are antipsychotics and antidepressants. Lithium has been found to be most effective in the treatment of mania. Another form of treatment in mood disorders is electroconvulsive therapy, or ECT. This involves placing electrodes on the skull and administering a mild electrical current that passes through the brain and causes a seizure. Treatment consists of 10 to 12 sessions at about 3 times per week. Serious side effects of ECT is memory loss. Next, we will look at personality disorders. Definition of a personality disorder consists of inflexible, long-standing maladaptive traits that cause significantly impaired functioning or great distress in one's personal and social life. The distress in an individual's life is partly due to the fact that such behavior is egocentric. The patterns are consistent with the ego integrity of the individual and are therefore perceived to be appropriate by that individual. This is again where, when we think about the bell curve and the social norm, this person's way of perceiving what is normal is not like most of us. The onset of these patterns of behavior can typically be traced back to late adolescence and the beginning of adulthood, and in rare instances childhood. It is therefore unlikely that a diagnosis of personality disorder will be appropriate before the age of 16 or 17 years old. In a study of almost 600 male college students, averaging almost 30 years of age, and who were not drawn from a clinical sample, there was examined the relationship between childhood experience of sexual and physical abuse and presently reported personality disorder symptoms. Childhood abuse histories were found to be definitively associated with greater levels of symptomology. There are 7 common types of personality disorders. The first one is paranoid personality disorder. This is a pattern of distrust and suspiciousness and perceiving others as having evil motives. Next disorder is schizotypal personality disorder, characterized by an acute discomfort in close relationships, distortion in thinking, and eccentric behavior. Histrionic personality disorder is characterized by excessive emotionality and attention seeking. The fourth personality disorder is obsessive compulsive personality disorder. It is an intense interest in being orderly, achieving perfection, and having control. Dependent personality disorder refers to a pattern of being submissive and clingy because of an excessive need to be taken care of. 6 is antisocial personality disorder, and it refers to a pattern of disregarding or violating the rights of others without feeling guilt or remorse. The 7th personality disorder is borderline personality disorder. Feelings about others often shift from positive to negative, generally after a disappointment or a perceived threat of losing someone. Also, the self-image can change rapidly from extreme positive to extremely negative. Impulsive behaviors are common, including alcohol or drug abuse, unsafe sex, gambling, and recklessness in general. Individuals with borderline personality disorder, or BPD, seek intimacy, but can be hyper alert to signs of rejection or not being valued and tend toward insecure, ambivalent, or paranoid patterns in relationships. Incidences in population on personality disorders are as follows. Paranoid personality disorder is 0.5 to 2.5% of the population. Schizotypal personality disorder is 3 to 5% of the population, and so on. As you can see, OCD is 4% and seems to be the highest in percentage for the population. Individuals with personality disorders have the following characteristics. They have troubled childhoods and childhood problems that continue on into adulthood. They have maladaptive or poor personal relationships, extreme abnormal behaviors. Most prisoners meet the criteria of having antisocial personality disorder, 50 to 80%. It is also known as being a sociopath. It's 3 times more common in men than in women. Looking at the continuum of behavior, personality disorders seem to be from delinquent all the way to serial killer. The characteristics are a constant pattern of disregard for or violation of the rights of property or property of others. Sociopaths, or people with personality disorders, will harass, steal, beat, destroy property, or kidnap or kill. Dishonesty and manipulation of others is also a trait of someone with personality disorder.